So good afternoon, everybody, and welcome to the first ever OneNeurology Global Advocacy Workshop. I'm going to get going because we've got a packed agenda and we want to ensure that we start and finish, hopefully, on time, because for many of us, it's coming into evening, although for some of you, I know it's morning time or much later in the day. So thank you for being with us wherever you are in the world. For those of you who don't know me, I'm Donna Walsh and I'm Executive Director at EFNA, which is the European Federation of Neurological Associations. And I'll be chairing the majority of today's meeting, but we'll be ably assisted by some members of our OneNeurology Global Partnership. And the reason EFNA is chairing and has organised today's meeting is because along with our colleagues at the European Academy of Neurology, we co-founded this initiative in March of this year. So it's a very young initiative. This is our first ever attempt to organise a global advocacy workshop, and we're really thrilled to have you with us this afternoon. We also had a session this morning, and our hope is that we can merge the discussions and the feedback and the presentations from both sessions into one consolidated report, which will inform how OneNeurology as an initiative is taken forward, but will also inform our response to the Global Action Plan on epilepsy and other neurological disorders, which we will be discussing in more depth with all of you later today. So with that, I'm going to move on to walk you through very quickly the plan for today's meeting. And as you can see, we're going to kick off by looking at the global burden of neurological disorders. What is the latest evidence of the impact that neurological disorders are having around the world, and why is it important to act now? We'll also look at the OneNeurology partnership and the wider initiative in more detail, bringing you up to speed in terms of what's been happening, where we're going, and talking about the added value of working together as one distinct discipline, as opposed to a set of fragmented disease areas. We'll then move in and narrow down the conversation on the Global Action Plan on epilepsy and other neurological disorders, and we will have Nurja Chowdhury from the WHO Brain Health Unit to present the plan to us. And then we'll get to the part where we want to hear from all of you around where you think we should be aiming with this Global Action Plan, and specifically what actions for which actors need to be contained within that. So we really hope to have an interactive discussion with all of you this afternoon. Then we'll have some feedback, and we will talk to Dr. Florence Bingana from WHO African region, who will bring a regional perspective to the discussions. This morning we had WHO Europe, so we should have a nice balance of perspectives there. And then we'll look at what's next, quickly bringing you up to speed in terms of what we're planning over the coming months to give you some more information on how and hopefully why you should get involved. So that's the plan for today, but let's start by having a quick recap of the burden of neurological disorders. And I'm pleased to give the floor to Professor Valerie Fagan from the World Stroke Organization, who is going to quickly take us through the latest data in this space. We have no sound today.
One second.
Good afternoon. I'm Valerie Fagan, co-chair of the Global Policy Committee of the World Stroke Organization and director of the National Institute for Stroke and Applied Neurosciences at AUT University, New Zealand. I am pleased and honored to present to you a talk about the global burden of neurological disorders and why we need to address it as soon as possible. The burden of neurological disorders is very fast growing indeed. It is already the leading cause of disability in the world, and almost half of that disability comes from stroke. It is also the second leading cause of death, and over the last 2.5 decades, the prevalence of neurological disorders has increased by 50%. Now, 1 in 3 people suffer from some kind of neurological disorder, spanning migraine to stroke and dementia. It is also the most expensive group cause of disorders, costing the global economy trillions of dollars every year. As you can see here, just the cost of stroke amounts to $700 billion a year. Dementia, $950 billion. Traumatic brain injury, $400 billion. And this is not to mention the enormous physical, psychological, and financial burden of neurological disorders on patients and their families. It is important to note that most neurological disorders, except stroke and to some extent dementia, have no proven effective prevention strategies. Therefore, there is an urgent need for more research into the causes of neurological disorders and effective preventative strategies. For a long time, neurological disorders were largely neglected by policymakers, and now we have a great shortage of specialist neurologists, especially in low and middle income countries, and no reliable epidemiological data on neurological disorders for the majority of countries in the world, with serious shortage of research funding. Yet, the burden of neurological disorders is likely to continue at a fast pace due to aging of the population. If we do not act urgently, collectively, and decisively, the situation will threaten the sustainability of the entire health system around the world. These measures include policy changes with public health priority given to neurological disorders, and, of course, reducing the burden of those neurological disorders where we have proven effective preventative strategies, such as stroke and dementia. Last year, World Stroke Organization published a declaration on primary stroke and dementia prevention that calls for the wide implementation of the population-wide and mass individual motivation prevention strategies via widely available and free-to-use e-health technologies, such as the free stroke riskometer app, community health workers, and simple interventions, such as polypill for blood pressure and cholesterol reduction in people at risk of stroke. The declaration states that primary stroke and dementia prevention should include people at any cardiovascular risk. It was estimated, with all these measures in place, the incidence of stroke and dementia just over 5 years can be halved, thus not only saving billions of dollars for the economy, but averting millions of deaths and suffering, unnecessary suffering, from those major neurological disorders. It is indeed time to act, and to act now. Thank you for your attention.
So that was Professor Valerie Fagan there of the World Stroke Organization, setting out what I suppose is quite a bleak picture around the current burden of neurological disorders and figures that really are soaring in the wrong direction. Valerie also set out the challenges that we face around the globe, and equally, if you feel that there are major challenges that we've missed from this presentation, we'd love you to put your further thoughts in the chat, and we will be collecting all of the feedback that comes into the chat box throughout today's meeting. So please do use it to comment and complement any of the presentations that you see today. But we asked Valerie to finish up on what is a positive note, outlining the fact that actually, although these figures are growing,
Hello, my
something
name is David
can
Todik.
be done. And I think it's really important that we bear that in mind and we think about the solutions that can be put in place when we go to speak with policymakers and decision makers. And it's those actions and those solutions that we want to consider as we move through the meeting today. But before we get there, we're going to move on to the next presentation. And this is from Dr. David Dodik, who is the president of the Global Patient Advocacy Coalition at the International Headache Society. And David is going to introduce us to the OneNeurology initiative, tell us what it's all about, but also give us an example from his field about how we can create globally and act locally. And that is what obviously this meeting is all about today. So let's hear from David now.
Hello, my name is David Dodik. I'm a professor of neurology at the Mayo Clinic in Phoenix, Arizona. And I'm delighted to be speaking to you today about OneNeurology's global initiative. I am the chair of the International Headache Society's Global Patient Advocacy Coalition and a proud member of the steering committee for OneNeurology. The goal of this initiative is really to make neurology our top priority because, as many of you know, neurological disorders and diseases are the most frequent, disabling, and costly of all non-communicable diseases. So the OneNeurology partnership is importantly a patient-driven and a multi-stakeholder partnership which aims to strengthen neurology-related groups, to stimulate collaborative advocacy, action, and accountability for the prevention, treatment, and management of neurological disorders worldwide. The founding partners of OneNeurology are the European Federation of Neurological Associations and the European Academy of Neurology. And the partners, which include multiple disease-specific organizations from around the globe, are listed here and continue to grow. We also have supporters, which you see listed here, whose support is very valuable to being able to sustain this initiative. So what do we want to have on board? Well, in the short and midterm, we want and need political stakeholders, medical and scientific audiences, and the wider patient community, because it's very important for the patient community to stand together, to galvanize, and to rise up, and their voice needs to be heard for neurology to become the global health priority that it needs to be. Long term, making people in the street understand neurology and brain diseases just as they understand, appreciate the impact of cancer and cardiovascular diseases. So long term, we need to be speaking with one voice, and we need people without neurological diseases to understand the prevalence and impact of neurological diseases. The objectives are really to unite the neurology community and all of its stakeholders together to stimulate collaboration in a multi-stakeholder partnership and to centralize the patient voice. That's critical. To lead global advocacy by pooling resources and expertise to optimize efficiency and effectiveness in our joint and in our individual actions. To strengthen the advocacy capacity of neurology organizations and alliances at all levels, national and regional level, because the capacity for advocacy varies considerably across countries and across regions. Fourth is to carry out all activities that we carry out to support the mission. And that will include programs, projects, campaigns, training materials, publications, events. We all need to be speaking with one voice, with a common goal and a common mission. If we do all of that, we will position neurology as a focus area within the broader efforts going on in brain health, as well as non-communicable diseases and other thematic policy initiatives of relevance. We will create a favorable policy environment if we come together for action on neurology, providing a platform for disease-specific advocacy efforts. We will also hold policy and decision makers accountable for implementation of political commitments, as well as to commit the resources necessary to carry out our efforts. And finally, one of our objectives, of course, is to share knowledge. At the end of the day, this is all about patient care. So it's to share knowledge on evidence-based interventions in neurology, supporting the scaling up of solutions so that patients all across the globe will be getting the care and the evidence-based care that they deserve. I'll share with you an example of a disease-specific advocacy effort that's occurring on a global basis, and that is the International Headache Society's Global Patient Advocacy Coalition, with which I'm very familiar as I've chaired this for the past 4 years. So we came together in 2017, and by we, I mean over 40 different organizations, which includes professional societies in neurology and pain and headache, as well as patient advocacy organizations around the globe. We came together, held a summit, and mapped out a blueprint for patient advocacy in the headache space, in the headache field, on behalf of patients around the world with headache. And we published that blueprint in a consensus statement in 2018. We then came together again in 2019, reviewed what our goals were, what our accomplishments were over the prior 2 years, and then refined our blueprint moving forward. We also published that Vancouver Declaration, number 2, as well, to make the entire headache community as well as the global neurology community aware of what we were doing. This is a template, I think, for what OneNeurology can do globally on behalf of all neurological diseases, and what individual disease-specific areas can do as well. So we unified globally, created materials so that individuals and individual organizations and patients could act locally and create country-specific strategies that were relevant to their geography. And then we monitor that centrally, receive feedback and input on what's working and what's not working, and then refine and iterate the tools, materials, initiatives, programs that can be used going forward. Now, there are many different advocacy areas that we could have focused on, but we chose to focus on advocating for students and employees. Because of the patient demographic that we see in the headache field tends to be younger people. 10% of all school-age children have migraine, for example, and the demographic of the headache community, particularly with migraine, is mostly women and mostly women of working age. So we decided to advocate with employers on behalf of employees. But moving forward, of course, there are many other advocacy domains that we will focus on. And when we implement these initiatives within employer spaces, we have 3 goals, and that is to reduce stigma associated with migraine in the workplace, to educate and empower employees to seek treatment and improve their well-being, and to ensure support for those impacted by migraine in the workplace. And I dare say that those goals can be common for all neurological diseases. So I think this is a template where we can replicate going forward for other neurological areas. So the 2 pillars of the OneNeurology partnership are representation and advocacy, and capacity building and knowledge sharing. And just to give you a sense of what's happening in 2001 and what's about to come, in the representation and advocacy domain, of course, we're advocating to make neurology a global health priority. So we're developing a coordinated response to the 10-year intersectoral global action plan on epilepsy and other neurological disorders that has come from the World Health Organization. And then from the capacity building and knowledge sharing point, we're empowering neurology groups around the world in advocacy and translating global commitments into actions that they can then implement at regional and national levels. And we're translating knowledge into action and supporting the scaling up of solutions and best practices, again, at regional and national levels. We have a number of parallel awareness-raising work streams that have been completed and that continue, including the build-out of a robust website, a very rich and robust podcast series, a number of infographics, and much more that's happening over this year and in the years to come. So my request, my plea, my call to action is to please join us in our effort to make neurology and brain diseases and other neurological disorders our collective and a global priority. Thank you so much for your attention.
So that was Dr. David Dodick there presenting the OneNeurology initiative and giving us some ideas, I guess, in terms of what direction that initiative and the global partnership in particular should take moving forward. And I think what I found interesting in that was how he spoke about the fact that they could have picked lots of topics when he was speaking about his work in the area of migraine on which to focus, but they honed in on a couple that they thought were most important. And this was something that came up in this morning's session as well, where we heard lots of the community talking about the need to bring the advocates on board. And if we are to do that, we need maybe to focus on the issues that we have in common rather than the diseases that come under the neurology umbrella. And I think as we work through today's meeting, we'll start to tease out what some of those cross-cutting topics and themes might be. And already some of these are flagged out in the work of OneNeurology. They're included in the Global Action Plan, but we may need to really hone in even further on a couple of key themes that are most important to us as a multi-stakeholder community in the field, and really go after those and try to make a difference in those areas. So let's keep that in mind as we're working through the discussion. What matters most to you and what can we do to make that a reality? Now, I'm not going to go through this slide, which talks about the added value of working together, because hopefully that is obvious, and this slide is definitely self-explanatory. But what I am going to do is to show you a short video that we have put together just these last few days. And within this video, you'll see perhaps some familiar faces who participated in our podcast series earlier this year in March. And if you haven't seen the OneNeurology podcast series, I suggest you go on the website and take a look, because there's some really great content there on different themes from lots of different perspectives. But this is some excerpts from that podcast series talking about the value of the OneNeurology initiative and why we need to work together as one. So let's take a listen now.
This is an extremely important moment in the field of neurology. This is the first action plan that WHO is developing. This is going to come out with a global framework, global set of actions, global targets, global accountability mechanisms. It provides us an opportunity to bring neurology under one umbrella.
We need to understand that certain goals, certain activities need a work together, and in that sense, the interdisciplinarity, multidisciplinarity, the concept of joining forces, I think it's my biggest hope in this initiative.
It is extremely important to work together for the sake of neurological illness and for the millions of people living with a neurological condition. The global burden of neurological illness has become so overwhelmingly big that we really need to start to work together globally.
The more organisations moving in the same direction with the same broad message, the more attention there will be and the more positive interventions and results.
There's definitely value in working together. There is definitely value in taking an integrated approach, which looks at the synergies and the cross-cutting issues, because clearly there are many, and clearly there is a lot of opportunity to collaborate in addressing some of these.
The initiative is also very good in a sense that it brings the key players together on an international level, on a national, on a regional level. It brings the patients and the physicians together. It brings the societies together. And I think that by itself is a very high value.
You know what can happen when there's a concerted focus and a collaborative and coordinated effort? You know what the result of that is? The result of that is something like a vaccine within a year in people's arms to a global pandemic. That's what we need. We need an international collaborative effort with all stakeholders at the table, creating globally and acting locally.
Having one identity will help us to really be more effective in collaborating and working together. And this is the secret for really facing the crisis and the challenges ahead.
I do believe that initiative and all working together is the answer, because if you break down neurology, it's so complex, and we're going to lose the politicians in all the different diseases. And I don't think that's what's key. The key is to get neurological diseases really recognized as a huge burden on society.
I'm convinced that OneNeurology, actually is making a change, because it's taking this first step in bringing everybody together in this family of brain and neurological conditions. And this is probably the first necessary step to be taken before we can go out and advocate.
Join us, work with us. We have an important goal, and we need all of you.
So hopefully that short video captured a little bit in terms of why we've come together as the OneNeurology initiative and where we need to go next. Now, if you do want to listen to the podcasts in full, as I said, they are on the website. And we've also just launched a new series. These are shortened versions, and these are our 10 Minutes With series. And the first one is with Dr. Dan Chisholm, who many of you will know has been heading up the mental health department at WHO Europe, although he's now moving back to headquarters to take up a role within the MSD unit there. And this focuses on the socioeconomic impact of neurological disorders. And it will be followed actually by 2 short podcasts with young people living with neurological disorders in lower and middle income settings, because we felt that was a real gap actually in the podcasts we recorded earlier this year. So do check them out. This one is hot off the press, or whatever the equivalent is in an audio world, and is available now for you to listen to. If you want to get more involved in the OneNeurology initiative, you can join us. We are eager for you to join us. Unfortunately, becoming a partner has some restrictive criteria, in that you need to be an international organization, or you can be a regional organization in the broader field of neurology if you cover more than one country and more than one disease within the neurology space. So it's either international disease-specific groups or issue-specific groups and regional umbrellas. But of course, there is the opportunity for you to also join us as an endorser. And we really do need your endorsement as an initiative if we want to continue to grow and to continue to build our credibility as an actor to engage with some of the key organizations such as WHO. Now, if you want to join as an endorser, on the OneNeurology website, there's a page called Partnership. And at the bottom of that page, there is a form where you can submit your details and get involved. Unfortunately, individuals cannot be endorsers. It's for organizations or departments, institutions. But if you are an individual and you're not affiliated to a group, you can actually sign up as a subscriber, and we will make sure that we keep you in the loop and continue to work with you. So there's room for everybody within the initiative, and we want you all on board. And one of the biggest reasons we need you all on board right now is because the first draft of the Global Action Plan on epilepsy and other neurological disorders has been published. And we really feel that a coordinated response from the neurology community is the strongest approach that we can make here in shaping a plan that works for all of us in all parts of the world. And we will come on to talk about how we can do that in just a few minutes. But first, let's hear from Dr. Nirja Chowdhury around the overarching structure and the contents of this plan. Hopefully some of you have read it already, but if not, here's a quick whistle-stop tour of the Global Action Plan. Let's have a listen.
Thank you for the opportunity to present to you the first draft of the Intersectoral Global Action Plan on epilepsy and other neurological disorders. In November last year, the 73rd World Health Assembly asked the Director General to develop an intersectoral global action plan that will address the challenges and gaps in providing care and services for epilepsy and other neurological disorders that exist worldwide and ensure a comprehensive, coordinated response across different sectors. As a first step, the WHO Secretariat published a discussion paper on the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, to which member states, UN agencies, civil society organizations, academics, private sector entities were all invited to share their comments through web-based and virtual consultations. These comments were then consolidated and published online. And the first draft of the action plan has now been developed based on the inputs received on the discussion paper and is now available for comments from all stakeholders. An important part of the comments and the consultations are comments from civil society organizations, especially people living with neurological disorders, as well as their carers. The scope of the action plan talks about the conditions that are affected and which are included. It also addresses functioning and disability as the result of interactions between neurological conditions and contextual factors. Rather than adopting a disease-specific structure, the action plan uses an integrated person-centered framework. Prevention of neurological disorders are addressed, as well as strategic linkages between the Global Action Plan and other resolutions and global commitments which are relevant to neurological disorders. For example, the Action Plan on the Prevention and Control of Non-Communicable Diseases, the Global Disability Action Plan, as well as the Mental Health Action Plan, to name a few. Now moving into the content of the action plan. The action plan proposes a vision, which is a world in which brain health is valued, promoted, and protected. Neurological disorders are prevented and treated, mortality and morbidity are avoided, and the quality of life of people with neurological disorders and their carers is improved. And people affected by neurological disorders fulfill their potential with equal rights, opportunities, respect, and autonomy. To achieve the vision, the goal of the action plan is to reduce the stigma, impact, and burden of neurological disorders, including associated mortality, morbidity, and disability, and to improve the quality of life of people of all ages with neurological disorders. In order to achieve the above stated vision and goal, the action plan also speaks about leveraging epilepsy prevention, treatment, and care as an entry point. The draft of the action plan has 6 guiding principles, all of which are reflected throughout the action plan. These are having people-centered primary healthcare and universal health coverage, adopting an integrated approach to care across the life course. Other principles include interventions for prevention, diagnosis, treatment, and care grounded in evidence-based practice, the importance of intersectoral action, and empowering people living with neurological disorders, as well as promoting gender equity and human rights. The action plan has 5 strategic objectives which help achieve its vision and goal. You see these listed here. Each of the 5 strategic objectives includes actions for member states, the WHO Secretariat, and international and national partners. I will briefly provide an overview of each of these strategic objectives and some of the associated actions, beginning with the first. This objective focuses on raising the prioritization of and strengthening the governance for neurological disorders. It includes a focus on advocacy, including awareness raising, which we know is key to enhancing public understanding of neurological disorders and to decreasing stigma and discrimination, enhancing access to treatment, and protecting the human rights of people with neurological disorders. The objective also includes a focus on developing and strengthening policies, plans, and legislations, whether as separate instruments or integrated into other planned multi-sectoral actions, for example, non-communicable diseases, mental health, disability, and other relevant areas across the care continuum for all ages. It also highlights the importance of revising discriminatory laws where they exist and strengthening accountability mechanisms and strategies to resolve claims and complaints to address human rights violations, for example, those related to education, employment, and women's rights. Another important consideration is appropriate and sustainable financing mechanisms. This action area also highlights the importance of financial supports as well as the need for appropriately funded policies and programs to ensure effective implementation. Also highlighted are resource mobilization strategies and approaches to increase investment in different areas, including early interventions, new technologies, diagnostic methods, and training of specialists and non-specialists, especially in low and middle income countries. The second strategic objective focuses on effective, timely, and responsive diagnosis, treatment, and care for neurological disorders. The first action here involves care pathways with a focus on essential elements such as community-based neurological services, integration in primary care, strengthening both emergency as well as chronic care delivery, ensuring continuity of care between providers and health system levels, effective collaboration between formal and informal care providers, such as traditional healers, and the role of self-care. Effective care pathways need to be responsible to the needs of people with neurological disorders and their families, but also take into account vulnerable population groups, such as those with emergency-induced neurological disorders, such as traumatic injuries. Strategic Objective 2 also emphasizes the importance of medicines, diagnostics, and other health products, such as assistive technology. As we know, diagnostics are essential to the early and rapid detection of neurological disorders or their risk factors. Essential medicines play a crucial role in preventing and treating neurological disorders, and ensuring access to these is crucial. Relevant examples here are medicines for epilepsy and Parkinson's disease, among others. Finally, assistive technology supports people living with neurological disorders to lead healthy, productive, and independent lives while reducing the need for formal health and support services. Health worker capacity building, training, and support is also a key element of Strategic Objective 2. This includes having a neurological workforce, but also competent primary healthcare workers who are very important. It speaks about implementing various modes of training to build the competencies of these healthcare providers. And finally, it's the Strategic Objective 2 focuses on carer support. We know that carers play a significant role in providing care for children as well as adults living with chronic neurological disorders. Therefore, acknowledging and ensuring appropriate policies, services, and supports are in place to decrease carer stress, financial burden, role strain, as well as social isolation is of pivotal importance. The third strategic objective focuses on promoting healthy brain health and development and preventing neurological disorders. A focus on optimal brain development in children and adolescents is important to reduce risk factors associated with neurological disorders. This includes addressing factors related to maternal health, such as nutrition and substance use, preventing congenital infections, addressing environmental pollutants, and enhancing physical activity, while limiting sedentary behavior, such as screen-based entertainment and digital communications. Then there is a need to promote healthy behavior across the life course. We know that there is growing evidence demonstrating the interrelationship between neurological disorders and NCDs, such as hypertension and diabetes. For this reason, we need to focus on reducing common risk factors, such as physical inactivity, obesity, tobacco use, and alcohol, while encouraging regular sleep patterns. A focus on controlling infectious diseases is highlighted, given that many of these, such as meningitis and neurocysticercosis, for example, have neurological consequences. Now more than ever, with the context of COVID-19 pandemic, we know the importance of controlling infectious diseases as a preventive measure for neurological disorders. This has also been demonstrated, as we know, through previous pandemics, such as Zika. We need to focus on preventing head and spinal trauma as well as other injuries, as trauma leads to disability and mortality. In doing so, it's important to consider how synergies can be created at the policy and legislative level amongst these different public health areas. There is also a need to reduce environmental risks, and these have been specifically alluded to in the action plan. The fourth strategic objective relates to fostering research and innovation and strengthening information systems for neurological disorders. Investment in research, as we know, is crucial and includes financial support, not only for biomedical and clinical disciplines, but also for implementation and translational research. This includes how we share information and how we can strengthen different collaborative arrangements such as North-South, South-South, and triangular cooperation. There also needs to be a focus on building research capacity and better engagement and representation of low and middle income countries in all aspects of neurological research. There is a need to identify and systematically collect and report on a core set of indicators on neurological disorders across the life course, as well as to strengthen information systems to collect data for reporting on neurological disorders. This is crucial not only to guiding and informing evidence-based decision-making, but also to identify ongoing gaps in health and social care system performance, which will then enable us to implement measures to improve the acceptability and coordination of care for people with neurological disorders. The fifth strategic objective, and the last one, relates to strengthening the public health approach to epilepsy and promoting synergies with other neurological disorders. It focuses on the importance of reducing the epilepsy treatment gap by integrating epilepsy care in primary healthcare by investing in capacity building of primary healthcare workers and improving access to quality, safe, and effective anti-seizure medicines, as well as diagnostics for epilepsy. It highlights the needs to improve care to prevent the common causes of epilepsy, such as perinatal injury, including hypoxic ischemic brain injury, central nervous system infections, stroke, and traumatic brain injuries. It also addresses the strengthening of monitoring and evaluation of epilepsy services through well-functioning health information systems. Then there is a need to engage and support people with epilepsy as well as their carers. This includes strengthening legislation to promote and protect their rights and prohibit discrimination against them. Also, people with epilepsy and their carers should be empowered and involved in advocacy, policy, planning, legislation, service provision, monitoring, as well as research in epilepsy. Finally, the last action area recognizes that epilepsy often coexists and can be compounded by other comorbid health conditions, including other neurological disorders. This necessitates a synergistic approach to addressing coexisting conditions. Also, a well-functioning epilepsy service can present a good opportunity to strengthen the management of other neurological disorders. This includes expansion of the health workforce capacity, epilepsy diagnostics, as well as epilepsy procurement systems to include those required for other neurological disorders. The action plan in its annex includes 9 global targets. These global targets are established for each objective and provides the basis for measurable collective action and achievement by member states towards the global goals. Indicators have been defined for measuring progress towards each of these global targets. The outcomes of the consultation on this first draft will serve as input for the WHO Secretariat to then prepare the revised draft. So as you can see, we are in the middle of the process now in developing the Global Action Plan. This will then be submitted for review by the 150th session of the Executive Board. And considering any guidance provided by the Executive Board, the 75th World Health Assembly may be invited to consider the Intersectoral Global Action Plan for epilepsy and other neurological disorders. Let me take this opportunity to urge you to read the draft carefully and to provide your comments and feedback. This is your action plan, and we do want to hear your views before preparing the final draft. We have a form that will be available online soon for you to fill, which you can use to send your comments either through the web portal or by email to us. And also remember that the last date for comments is the 5th of August. Thank you so much for your attention.
So that was a lot of information in a short space of time from Dr. Chowdhury, and certainly we would echo her call for you all to read the draft if you haven't already and to provide your comments directly to WHO, but also please feel free to send your comments back to us, because what we want to do is to put together a response as OneNeurology and make sure that our response is reflective of the wider community. So we'd be really eager to hear your thoughts when you've had the time to read the plan in more detail in terms of what's missing, what needs to be strengthened, and how we can really make it something very workable, because it's very broad and it's very wide ranging. And as I said earlier, we may need to prioritize areas in which we want to get particularly active. And with this in mind, I'm going to hand over to my colleague Tadeusz Haberat. And Tadeusz is going to present a couple of questions that we had on our side when we read the draft for the first time, and things we think maybe we need to think about in a little bit more detail before we provide our response. And equally, if you have questions or comments on the draft that you think need to be teased out a little bit further, feel free, as Tadeusz is presenting, to stick those in the chat, and hopefully we'll have time to bring those into the discussion later on today. So Tadeusz, for now, over to you.
Thanks for the intro, Donna. I would like to start with what we already heard during the OneNeurology video, where Dr. Tarun Dua said that this is an extremely important moment in the field of neurology. And I think it's really setting the scene, and we should perhaps let it sink in for a moment and recognize that we have this immense window of opportunity that is opening up for neurology. And this window is not opening for a few months or a few years, but it's going to be a full decade, which will be fueled by implementing a global vision, implementing this global framework, set of actions, targets, accountability mechanisms. So with this, we are really pleased with the work that the WHO Brain Health Unit has done. And this is both in terms of all the actions that led to where we are right now, and also now for shaping the plan itself, the plan that captures so skillfully all the key dimensions that are related to neurological disorders and also to brain health promotion. It is still a bit early for us to speak about our detailed comments to the plan, not least because first, we want to hear from OneNeurology constituencies, and we want to hear from you. What do you think about the plan? What will be the most important priorities and actions for your communities? And with this, we can bring this all together and then come up with this coordinated response that David Dodig was mentioning during his presentation. So I heard somewhere that being wise means having more questions than answers. And with this, we would want to start with a set of questions, as Donna said, a set of questions based on the draft plan, which can hopefully help us here to frame our discussions and invite more dialogue around some of these topics that will be then featured in the plan and its implementation. So with this, we have a dozen of questions. First one, I think, this is really underlying everything else. How can we ensure mobilization of financial resources at all levels to safeguard a successful implementation of the Global Action Plan, including dedicated budget lines at the national level? How can we ensure sustained accountability of key actors and key actions? And here, related, how can we build in a strong core set of indicators and targets? And this should include intermediate targets as well as processes for ongoing monitoring and review of outcome measures. And this is really important because the timeline here is 10 years, but obviously we really want the countries and all the involved actors to start already now rather than wait 8 years or 9. And surely this is more of a marathon than a sprint. So it's important that we measure progress as we go. How can we align those targets with other global action plans, with other frameworks dealing with monitoring and accountability? How can we increase the significance of neurology within broader global health dialogues? As an example, how can we make sure that neurological diseases be integrated with schemes such as global commitments on NCDs that include current work on the NCD implementation roadmap with a 2030 horizon. Also knowing that the neurological diseases are the second leading cause of global mortality, we should really make sure that this is reflected in areas such as sustainable development goals, in particular goal 3.4, which is looking at reducing a premature mortality from NCDs. For now, neurology as a whole is not really included there, and needless to say, it has to be if we are to meet these goals. Then we will have a 5x5 agenda, and as you might have heard already, this is dealing with 5 main non-communicable diseases and 5 risk factors. And in 2018, mental health conditions were added as the 5th group. Back then, they included neurology, but now we see this work at the WHO level of decoupling neurology and brain health from mental health. So it seems like we now have a 6x5 agenda, and we really, whatever it's called, we should make sure the way forward that neurology is well visible in these broad policy lines. Moving on, how can we tailor the plan to realities specific to regions, including a role of WHO regional offices in mapping unmet needs of the regions and mapping what initiatives already exist and creating targeted action frameworks based on things like technical reports. How can we ensure that member states and international partners are aware of and use the latest evidence-based data? And this is still something that needs improving, because often neurology is not really recognized for its high disease burden. Stroke is not really recognized still as a cerebrovascular disease, but rather cardiovascular, and we know that it has been reclassified in the latest classification of diseases. Similarly, often Alzheimer's disease and dementias are seen purely as mental health, and while there is surely a mental health component to them, there is also a case for them to be in a neurological basket. How can we encourage generating more data on protective factors and on risk factors? And it's important because those data can inform preventative measures, can inform treatments and care options, and also lead to the development of better disease-modifying strategies. How can we generate more data on economic impact on neurological disorders? How to improve collection of epidemiological data at the national level and integrate monitoring of neurological diseases into routine information systems and across all levels of care. Is there a need to perhaps to designate a global annual day and also a global annual meeting which could be dedicated to neurological diseases and brain health, perhaps mirroring what we already have for mental health with the Global Mental Health Forum, which takes place annually? And finally, what can we do to further increase a meaningful involvement of civil society and people living with neurological disorders and their carers? Thank you.
Thanks, Tad. So lots of food for thought there, I think, and lots of questions that definitely need to be answered before we submit our response to the Global Action Plan. In the chat, I have put the email address of the OneNeurology initiative, so feel free to send us your comments, but as we already said, feel free to also send in your own specific comments to the consultation to WHO directly. I think the more voices pushing in the same direction, the stronger we will be as a community. I also saw in the chat a comment from Mags Rogers from the Neurological Alliance of Ireland, who said that actually this framework being proposed by WHO will help us to really bring the neurology advocacy groups together and all of the actors in the space together, because in Ireland, which is also my country, we have lots of disease-specific strategies, but no real overarching framework for neurology. And this is something actually that we want to put to you now, because we have some polling questions to try to get a sense of the situation in your countries and in your regions across the world. And we want to ask you where neurology is positioned within your public health agendas, but also where you would like it to be and where realistically you think it could be in the next 10 years. But we've got a starter question first before we get into those specific questions, and hopefully you can see it on your screen now. And this is asking you if you feel that policymakers in your country are aware of the global or the local burden of neurological disorders, and whether you feel they're prepared to act on that in an appropriate way. So are your policymakers prioritizing and resourcing neurology in line with the burden of these diseases in your part of the world? And I can see that the votes are coming in. So I'll leave that on screen for a couple more minutes. If you're representing a global or a regional organization, perhaps you can vote from the country in which you're living, or maybe the country that you feel you know most about, so we can get the broadest perspective possible. Okay, so I'm going to share the results on the screen now, and you can see that in most cases, you are saying no. Almost 90% of you saying you feel that policymakers in your country are not aware, and if they are aware, they're not prepared to act on the burden of diseases. Only 2 participants in this session feeling that policymakers acknowledge and act on the burden of neurological disorders. So we're starting from a very low base, I guess. The next question then that you should see coming up on your screen is around the position of neurology in your country. And what we want to know is there a standalone strategy for neurology in your country? Is there a wider strategy on brain health? And by brain health, we're talking the WHO definition of brain health. So promotion, prevention, neurology, and potentially maybe a little bit of mental health included in there. Is neurology integrated in efforts on chronic diseases in your country? Or is it integrated into efforts on mental health? As we heard earlier, in some countries, there are some disease-specific plans, but no overarching strategy. Is that the case in your country? Or is neurology just left off the agenda altogether, as far as you're concerned? If you do choose other, because other is also an option here, maybe tell us in the chat what's the position of neurology in your country so we can get a sense of where we're starting from. And also you can actually pick more than one here. So if there's a little bit of something and a little bit of something else, feel free to pick a second option if needed. Okay, so on my screen, I can see the bars are still changing. So I think people are still voting. We'll let it up for a couple more minutes. Well, not minutes, seconds. Okay, let's share the results as they stand now. And you can see here that in 50% of cases, we have disease-specific plans, but no overarching strategy. And unfortunately, that is followed by neurology not being on the agenda at all. So clearly we have a bit of work to do. There are a couple of people who have said neurology is included in a standalone strategy or a plan in their country or a wider strategy on brain health. And maybe you can tell us where you're from in the chat as well, because I think earlier we also had some examples of where there are good plans for neurology and brain health, and we felt it would be good maybe to use these as templates and frameworks for other parts of the world. So if you do have one in your country, maybe give us a link and let us know a little bit more about that. Okay, the next question has the same set of answers, but it's a slightly different question. And this is about where you believe actually we should be. What's the most desirable outcome in the next 10 years? Do you feel we should be pushing for these frameworks for neurology? Do you think we should be pushing for wider brain plans? Do you feel it's better to have all these disease-specific plans because it makes no sense to have a neurology framework? Or do you think we should be starting to integrate neurology into efforts on non-communicable and chronic diseases or efforts in the mental health space? Where's the best place that we could position neurology to really add value to what you do in your group and in your country? Okay, so I can see the votes are coming in, and actually it's changing all the time in terms of the preferences for the groups. Give it a couple more seconds before we close this one. And again, if you have other ideas on where neurology should be positioned, feel free to choose other and to tell us a little bit more in the chat. We'll be picking up all of the input you put in there. Okay, so here the winner by a small margin is Wider Brain Health Plan, followed by Standalone Strategies for Neurology. And actually this is reflective of this morning's results, where also the brain health angle was definitely favored by the participants as opposed to the standalone strategy for neurology. But interestingly, this afternoon, I also see that there's a lot of suggestion that perhaps we should be using disease-specific plans as entry points for neurology and building on work that has already been done in specific disease areas. So that's maybe something we need to pick up as well when we look at the actions arising from the Global Action Plan. Okay, and the last question, and this is very, very similar to what you've already voted on, but this is really what you think is most realistic. So we know where we are now, we know where we want to go, but what do you think is achievable in the next 10 years? Do you think it will need to be through disease-specific plans as entry points? Do you think we can achieve standalone strategies for neurology in the next 10 years? Or do you think we might need to use entry points in areas like non-communicable diseases or mental health to bring neurology onto the agenda in your country? Or are you completely pessimistic and think there's no way we're going to make any progress here at all? Okay, so I see the votes are still coming in. And it's quite close, so keep voting if you haven't voted yet. Okay, so on this one, it seems that most of you feel we might need to use disease-specific plans as an entry point for neurology, or to integrate neurology into efforts on NCDs. And a brain health plan is seen as more achievable than a standalone strategy for neurology. So very interesting. And what we will do actually is merge this with the results we had to these polls earlier today, and really get a picture of where we are, where we want to go, and what we think is more realistic in the next 10 years. But the reason we wanted to do the poll this afternoon was to really see if we could provide a context for the discussions that are happening next. And so when we look at what actions need to happen and how we can support our advocacy efforts, we do it with this in mind, and this direction of travel in our minds as we take that discussion forward. So thank you for casting your votes. And at this point, I will hand you over to Sarah Belson from the World Stroke Organization, who is going to moderate the discussion. We were going to move into breakout groups, but because there's only 35 participants this afternoon, I think we'll keep the group together. We will stay as a whole. And so Sarah, over to you.
Thank you, Donna, and my pleasure to be part of this group today. And actually, these polls are some of the beginning of our collaboration together. So we're going to go through 3 questions. The first question has 3 parts to it, and the poll doesn't display all of the options fully. So I'll read through the options. I'll try and speak as clearly as possible, but if you need me to repeat anything, just let me know. And I'm assuming, Donna and Tad, that everyone already has the instructions and knows how to complete the poll.
Yes, let me come in on that, Sarah. So we will be using a platform called Menti, and just as I speak now, I am sharing in the chat instructions. It's very easy. We ask you to go to menti.com. If you can, better even on your smartphone, like this, you can both follow the meeting and vote on your phone. Otherwise, the computer is just fine. So you type menti.com as displayed in the chat, and then you have 2 options. Either you input the 8 digits that you can see in the chat, or actually you just click directly on the hyperlink and this should bring you to the poll. Once you're in the poll, please refrain from voting just yet. You'll have up to 3 options to choose from. Choose your first priority. If you need, choose more options too, up to 3. And then once you finish, then make sure that you click on submit at the bottom of the page. And with this, I am going to share my screen, and if there are any questions, please let us know.
Okay, so what I'll do, I'm assuming that everybody has been able to join. If you're not in, just let us know if you have any problems in the chat. And so the first of the three questions: what is the single most important action for member states or your national government? So the options are: collect data on burden of neurological disorders and improve data collection system, support research into prevention and treatment, ensure equitable access to treatment and care, run awareness campaigns on neurological disorders and their impact, run awareness campaigns on brain health, promotion and prevention, provide platforms for multi-stakeholder dialogue, knowledge exchange and capacity building, empower and resource those affected by neurological disorders, their carers and representatives to participate in service planning and delivery, strengthen health and social care workforce capacity, develop tools to support programs aimed at accessing integrated care, and provide dedicated staff and budget line to neurology within ministries. And there's also an other option. So I can see that the voting is coming through. So data collection, often and surprisingly, is a priority. And for those of you that have answered other, it would be great to for you to note in the chat what you consider the other most important action for member states and your national government. Great. So I think those answers are complete now. Oh, we've changed again. So apologies. So data collection has moved off top spot. So we've got research and ensure equitable access. Great. Thank you, Tad. So if we move on to the next part of question 1. So what is the single most important action for WHO regional offices? So the actions are: map unmet needs in the region, prioritize global action plan actions and adapt targets accordingly, provide platforms for multi-stakeholder dialogue, knowledge exchange and capacity building at the regional level, ongoing monitoring and providing guidance and technical support to member states on the Global Action Plan implementation, appoint a dedicated staff to neurology or amend office structures to reflect HQ, work internally to integrate neurology in cross-cutting areas or regional flagship initiatives, conduct regional epidemiological research, promote awareness of brain health, promote awareness of neurological disorders, support efforts for building new regional data sharing programs and initiatives, facilitate civil society involvement in the Global Action Plan shaping, implementation and monitoring. And again, if you feel that there are other actions that are missing from this list, please select other and tell us more about that in the chat. And if you find it tricky to select only one action, you can as Tad said, select up to 3. So I'll be a bit more patient with this polling and see where it settles. So it seems that mapping unmet needs in the region and prioritising actions is the priority action for over 1/5 of us.
And interestingly, Sarah, that's exactly the same as it was this morning. So there is definitely consensus across the groups, despite the fact we've got a very different mix of countries and disease areas this afternoon.
Yeah, really interesting to see that. Okay, Tad, let's move to the third part of question 1. So what is the single most important action for WHO International? So the first action, provide platforms for multi-stakeholder dialogue, knowledge exchange and capacity building at the international level. Develop a core set of indicators and targets and monitor progress of the Global Action Plan implementation. Provide guidance and technical support to WHO regional offices and member states on the Global Action Plan implementation. Conduct global epidemiological research. Coordinate global access initiatives. Promote awareness of brain health. Promote awareness of neurological disorders. Work internally to integrate neurology in cross-cutting areas, e.g. NCDs, universal health coverage and access. Support infectious disease control. Support efforts for building new global data sharing programs and initiatives. Coordinate global funding mechanisms. And finally, encourage civil society involvement in the Global Action Plan shaping, implementation and monitoring. And again, if you feel that there are other actions that are not listed, please let us know. That's great. So thinking, well, it's still moving, still votes coming through. So global access initiatives and the coordination of these. Global research is taken over. Okay, so global research and global data sharing. And again, Donna, I don't know how that relates to this morning's session, if there's any consensus there.
Yeah, it's broadly similar. Interestingly, platform for exchange was low this morning as well. And when we spoke to the regional representatives, they were saying, you know, one of the things that we do very well is provide a platform for exchange, but it wasn't something actually that people prioritized either for the regional offices or WHO International this morning, which is interesting. And the other thing that's interesting is that internal integration is 0%, because for me, actually, I think WHO International plays a key role in really pushing neurology to be included in work that the colleagues are doing on rehabilitation, on aging, on disability, on non-communicable diseases, on universal health coverage. I think that's, you know, one of the things that should be top of their list, but obviously no one agrees with me. So that's interesting. Actually, I think that's ranked so low. But well, that's about, because if it was just me going ahead, that's what I would have went for. So I'm really glad you've put me on the right track.
But also, if anyone has any thoughts about why they haven't prioritized that, that would also be interesting to hear in the chat. Okay, moving on to the second question. So, actions for civil society. What actions should partners, including our civil society organisations, commit to undertake. So the first, advocate for the involvement of people living with neurological disorders, including their families, carers and representatives, in the shaping, implementation and monitoring of the Global Action Plan. Second, run awareness campaigns on neurological disorders and their impact. Run awareness campaigns on the importance of brain health. Generate real-world evidence and patient-centered data on the burden of neurological disorders. Provide training and capacity building for advocates. Strengthen our links with similar organisations worldwide and work collaboratively, aligning on key messages and speaking with one voice. And again, if there's anything else that you feel that is not included, that our civil society partners should prioritise, then please include that in the chat. Okay, I think that's settled. So the priority, advocate for the involvement of people living with neurological disorders, and equal priority that's come out on front is run awareness campaigns on the importance of brain health. So yeah, great to see those coming through. And also, I think for me that training and capacity building is identified as a priority as well, or as a leading priority. Particularly, you know, from my background with World Stroke Organisation, that is a key priority for us. Okay, moving to the third question. So what support as civil society organisations would you value most from OneNeurology in support of your advocacy? So here's your opportunity to make some asks of OneNeurology. So the first action, provide a platform for knowledge exchange, pooling resources and sharing good practices. Offer capacity building opportunities in global public health policy and advocacy. Provide latest information on key political and scientific developments related to neurology. Support the creation and ongoing work of national and regional neurological alliances. Organise thematic meetings with global policymakers and multilateral agencies such as WHO, Global Fund, World Bank. Advocate for more meaningful involvement of people living with neurological disorders. Provide networking opportunities. Create editable advocacy resources based on global data. Organise awareness campaigns on cross-cutting themes. And anything else, any other actions that you feel that OneNeurology could be supporting. And I think that is settled. So, oh, we're moving now. So I think the second, the leading action is offer capacity building opportunities in global public health policy and advocacy. And second, organise awareness campaigns on cross-cutting themes. So again, Donna, I don't know if that was there was consistency there with this morning, but I think there's quite a clear message there about what OneNeurology could be supporting civil society with.
Yeah, this morning there was quite a high vote for the advocacy and policy training as well as the support to build regional alliances. I think they were the sort of the two top ones. This afternoon, bit of more focus actually on awareness campaigns, which I think is interesting. And also one of the differences I noticed was this morning, there seemed to be a lot of focus on brain health awareness campaigns, and this afternoon a little bit more focus in these questions around maybe the need to look at neurology more specifically. So I think that's sort of the difference that I've noticed, but broadly I think quite similar to what we saw earlier on.
So thank you, everyone. Thanks for your engagement, and really interesting to see what you identify as the priority actions.
Thank you, Sarah. Does anybody have any comments that they want to make at this point from the floor on any of what has come out of the polling? Anything you think is missing or anything you really want to emphasize? Please feel free to raise your hand or just to take the floor and to give us your thoughts on what we've just been discussing. David, I'm going to pick on you as representing the European Academy of Neurology to maybe say a few words about what you felt in terms of the approach that you've seen outlined here. So I'll give you the floor. Then I see David Oliver has put his hand up as well. So the two Davids, David Vaduchek first, and then I'll hand over to you, David Oliver. And you're on mute, David.
Yes, thank you. Thank you, Donna. First, congratulations. I think this effort of ours is quite astonishingly successful. For myself, you know, as a neurologist, as a professional, and used to working with patients, but also patients associations, I'm just extremely happy that so many voices gathered here. And I'm not surprised that there are differences in opinions, and perhaps I, as a professional, would choose the answers differently, but I think it's extremely important that we gather together in a sort of first step, you know, to do more together. And I think by staying together, discussing and reaching for a consensus, we can really be successful.
Thank you, David. Second David Oliver, floor is yours.
Thank you. I come from palliative care, and it's very interesting. We do talk about the care issues, but I think, you know, it struck me, and in the GAP paper, there's we need to be realistic about that many people are going to die with neurological disease, and their access to palliative care and a good end of life is often very low for neurological diseases. So it's just to raise that as a slightly different issue, I think. It's in there, but we need to be aware at all stages how we help people through the whole process. It talks of life processes, but it leaves off the death bit in the WHO document. And I think we need to remember that patients are going to, all people with neurological disease are going to die of their neurological disease or with their neurological disease sometimes.
Absolutely, and I think this is something that we have also trying to get across in our advocacy at a global level, that there was often this perception that, you know, neurological disorders are chronic long-term conditions, and aside from a handful of the disorders, they don't really kill. But we know from the global burden of disease data that was presented earlier that these are now the second leading cause of mortality worldwide, and those mortality figures are going up. And if you don't die from it, as you say, you die with it, often having progressed to a point where you do need that palliative care. And the same goes, I think, for neurorehabilitation, which is a similar, I suppose, cross-cutting issue in the neurology space that again is mentioned in the document, but maybe isn't really fleshed out in a way that we would like to see it. And maybe if there are other areas that people feel get a mention in the document, like palliative care or neuro rehab, but aren't really expanded upon enough, it would be really useful for us to actually understand that as well. So Absolutely. And I see that Alice in the chat has put in, there's not really any mention of nurses in the workforce section. And again, we know the value of specialist nurses and even the general nursing community in this area. So that's also something that we should certainly take on board. Thank you all. Alexandra, I see you've got your hand up.
Hello, everybody. A patient speaking. Sometimes it's important to raise the voice and speak out from our point of view. In my case, what I feel the most important is that we act in order to have everybody on board in the idea of pushing the agenda of the neurological disease. I think it's very important for the patients, for their families, that the question isn't on the table and in the discussion. Because what we feel the most is we feel that many times we are segregated, we are forgotten, our quality of life is very low, we don't have opportunities, we have the burden of stigma on us. And what we feel that is quite decisive to give real quality of life and real expectations to the patients of neurological diseases is that everybody is on board and everybody agrees in a common agenda to progress the treatment and the respect upon the people with neurological disease. In my case, I'm an MS patient. Thank you very much.
Thank you, Alexandra. Yeah, absolutely essential. I think that we are all working together in the same direction on this one. And I think the quality of life angle that you bring up is also important, because actually if you look at the targets at the end of the Global Action Plan, something from my perspective that I felt was missing was actually any targets or indicators that we're going to monitor improvement in quality of life. And I know it's really hard to have a global target looking at improvements in quality of life, but it's definitely something that could be done at a member state level through interacting and engaging with those people living with the neurological disorders. And I feel if we don't have some sort of target in there that tries to capture that, then we're really missing something very essential. And you can run all the awareness campaigns that you want, and you can add as many neurologists as you want to the health workforce, but if quality of life is not improving, then what's the point? So I think for me, it's really essential actually that we strengthen that aspect of the Global Action Plan. Action Amos, I see you've got a hand raised, and then Nancy, I'll come to you.
Thank you, Madam Moderator, for recognizing me. My name is Action Amos, and I'm from IB Africa, where I'm the Vice President. And I'm not speaking only as the Vice President of IB Africa, but also as a person with epilepsy myself. So I really enjoyed the discussion that's going on. Unfortunately, at one point I had dropped off because of a network, so I might repeat what others have already said. But I wanted just to highlight from my own perspective and from the discussions that we have started, I think one other key important issue that we want to see for us as persons with epilepsy is to ensure that there is empowerment for persons with epilepsy and those with other neurological disorders, so that we are able to engage meaningfully with all the processes, as well as engage at national level, as well as at regional level. I would want to highlight that mostly as persons with epilepsy, we have been marginalized for a long time, such that even in decisions that affect our own lives, we are not included. These are done by those that are called experts. But then just to highlight that, I think we also have the lived expertise that we have, so we'll be glad if we are not left behind, and to ensure that all the processes and everything that we are doing is going to be inclusive of those that are affected. By doing so, I think we will be ensuring that whatever is going to be done is going to be sustainable, and also the impact and the ownership is going also to be there to those that are affected, like myself, a person with epilepsy. Thank you.
Absolutely. And actually, I see that you've had lots of thumbs up as you've been speaking about ensuring that we empower and involve those people with the lived experiences. So there's clear agreement, I think, with the group with what you've said. And also, I think from our side, we also have to give a lot of credit to you in the epilepsy space who have been working with WHO for so long and really, you know, have got this initiative off the ground. And, you know, we have and other neurological disorders now added on the end, which I think is a real positive for the broader community. But I think the work that the International Bureau for Epilepsy has been leading in the advocacy space globally, there's definitely a lot for us, I think, to learn from you and a lot that we can replicate. So we definitely hope to continue to work together on this and to build something that works in everybody's best interests. Thank you so much. Nancy, I saw you had your hand raised.
Yes, I did. I was thinking that I didn't have a chance to read the 32 papers, so I'll be clear about that. So I'm not sure what's in it completely, but neurology is a very complex field, and the question I ask myself every time is, we get seen by neurologists and other doctors, but because of the complexity, it's difficult to get an answer. So why can't there be more honesty about the fact that it takes longer to get an answer, and because it's not only affecting the patient, it's not only affecting his quality of life, but it's also affecting the people they live with, their family. So I really understand the complexity of the brain and the neurology, but honesty needs to be in there too.
Yeah, no, absolutely. I think we definitely have to sort of manage expectations here, be open and honest, but also, as you say, you know, it is so complex. There is so much that needs to be done, that early diagnosis is also key, and early accurate diagnosis. That is reflected in part in the plan, but perhaps it's something that we need to look at in terms of how that could be strengthened. And this morning, actually, the representative from WHO Europe was talking about innovation and also talking about digital health, and how in Europe, at least, there is flagships initiatives in that space. And she felt actually that there was huge scope for neurology to be one of the sort of exemplars or the case studies in that sphere of digital health. And perhaps we also need to be thinking about that sector as a place through which we can maybe connect some dots and really bring that innovative angle into how we diagnose, treat and care people living with neurological disorders. And as you say, maybe not just focusing on what we've done in the past, whether that's been good, bad or indifferent. So yeah, Nancy, that's a good point. I see that, Jana, you put in the chat as well, have we been thinking about connecting with the rare disease groups? And this is something we also need to think about. And I see Alex has replied to say that we've been in touch with Rare Disease International, because the majority of rare diseases are actually neurological. And there's a huge crossover between the diseases that come under the neurology umbrella and the diseases that come under the rare disease umbrella, which in some places has actually gained more traction in terms of the global public health agenda. And they're certainly doing a lot of work as well around universal health coverage for rare diseases, for example. So I think it will also be important to see where those overlaps come. Tad mentioned the non-communicable diseases. but we also have communicable diseases in this space. So meningitis, for example, are one of the partners. We've also been speaking to some of the groups working in the area of long COVID, which, you know, potentially now is going to be seen as a neurological syndrome as well. So we probably have to do a piece of work in terms of positioning neurology with some of these other umbrellas, and looking at, you know, what we should do specifically in this sphere, but also then how we better link out to activities and initiatives happening in other spaces. I also saw in the chat, Jerome mentioned the need to think about the neurological and the brain health of refugees and asylum seekers. And again, this is a good point, and we've spoken in other sessions about gender, we've spoken about marginalized and vulnerable groups, we've spoken about people, you know, in lower middle income settings compared to high income settings. And maybe this is also a conversation to be had as well around making sure that we're leaving nobody behind, and that we are making sure that anybody who could be touched by a neurological disorder is covered by this global action plan. So very good points to take forward as well. At this point, Alex, I see no further hands raised, so maybe I'll hand over to you, because I know you've been keeping track of the discussion, and maybe you can do a little bit of a wrap up before we take a short break and move on to the next session.
Thank you, Donna. All right, so maybe just to summarize what have been said and what came up from the polls. I think everyone here see the most important action for member states being research, and we're not going to go back in detail about the poll of this morning, but I don't remember this was the main one. Anyway, the other key points also for that one would be ensure equitable access. It was quite close with the research one. The other important action for the regional offices, so for the World Health Organization, regional offices, would be to really provide a mapping and prioritize unmet needs. This was what came first. And the other one very close was to monitor and guide member states. And I would say that this one, the monitor and guide member state, this is really one of the prerogatives of the World Health Organization regional offices. So this will certainly take place. The most important action for the WHO Secretariat here in Geneva is to look at global research. It came exactly at the same level, global research and global data sharing. And this is actually very relevant because I think we miss that aspect. We miss some data, and we miss to really pool and optimize this knowledge. The other aspect was for the civil society organization, so it means us, and the action that really came up high was to advocate for involvement. And I would like to echo the testimony of what we just heard from Alexander and from Nancy. I think often we look at policy development, like this global plan of action, and I always feel that as a patient, it takes time to really understand what does it mean really for us as patients, for you. Here, the policy framework really target member states because there would be a change, but it doesn't happen necessarily right away. And I feel sometimes some frustration for the patient that it's not really, the change doesn't really happen. Luckily here we have a 10-year plan, so I'm not going to diverse on that. It's not my role here, but what I want to say is that you really have an opportunity, even as a patient, to really influence what is going to be adopted. I know it can look far away from your own needs, but I want to believe that it's possible here to really influence right now. So I go back to the thing, but I wanted to really echo what you just said. So advocate for involvement because patients feel often left out. And then the second one that came at the same level was awareness raising for neurological disorder. And I think this will have to stay more and more because sometimes even some member states may not understand why neurology should be handled as one, or why should be even be a priority in spite of the burden, etc. So this is something the civil society will have to keep doing. And this is one of the main objectives of OneNeurology. The other key point that came for that was training capacity building. Again, I think we see that often at national and regional level, if we want a bit of a coordinated approach, but at the same time taking into account the disparities of the different regional and national, it's important that we enhance that transfer of knowledge, that capacity building, basically. It's something that OneNeurology also is looking at, how to enhance that at all levels. And then the suggested support for civil society organization within that framework, within the gap, again, is really advocacy and policy training. And it makes sense. I mean, at the moment, at regional and national level, we don't have the capacity that is really there. We have a lot of different organizations that work on this is specific, but there is not one community that is really focusing on neurology overall. And this is something that we want to look at. And the other key points that came on that one was awareness campaign. It's very much linked with the action for civil society organization that you pointed out, which is again awareness raising. And then to finish on the other aspect, I didn't put it here, I didn't have time, but I did the list here. And I would like to emphasize on the one that you mentioned here. It's stigmatization. I think it's really something that we need to make sure that the plan, the final plan, we really look at stigmatization. How are we going to work with patient and carers and family on that? The second one was to make sure that we also can learn from epilepsy. I like very much the input of Action Vemos about the fact that in certain countries, notably in Africa, we know that this is something that we can learn a lot from the community of epilepsy there. So we hope we will be able to join our action here. The third one was to make sure that we also take into consideration the one that are the most neglected population, like the refugees and asylum seeker. And again, this is something that came up in other discussion, and this is something that we would like to really look at, how we can make sure that we integrate the most neglected or vulnerable population. One of the last, I reached the end, it's the difficulty of being diagnosed. I take this really in that list because it's really something important for many diseases that are not so well done in the neurological field, and notably ME, myalgic encephalomyelitis. This is really something that is serious, because patient can take 10 years to be diagnosed. So is the plan really enable to sort it out, those type of issue? This is maybe the vision, this is the approach we need to have with the plan right now, if you want to look at it and then provide comments to the WHO. Is the plan, the way it is now, address those issues that have been listed here? And the last one is about the rare disease, making sure, the rare neurological disorder, making sure that the plan also will enable to find solution for those particularities here. So to finish, it's OneNeurology, but at the same time, it has a lot of different disparities and aspects that we need to make sure that the plan cover. Thank you. I hope I was not too long, Donna. Sorry for that.
No, Alex, we can blame you if people don't have time to have a coffee, but no, actually, it was really good, I think, in terms of wrapping up the discussions that we've had over the course of the afternoon. And as you were speaking, there were a couple of comments in the chat adding sort of more food for thought, but also mentioning that, you know, we have to remember that this is a small group of 30 participants, and we need to continue to engage with the wider community to make sure that the issues that maybe we've brought up and we've spoken about are reflective of the wider issues on the ground. And my response in the chat and to all of you is, you know, we really will want you to take a look at the consolidated response that we're building and to continue to feed back to make sure that that is as reflective as possible. And we're happy to work with you directly, but we will also be working through the international and regional partners we have within the OneNeurology initiative to make sure that they are also feeding in, and what we produce at the end of the day should really be a sort of consensus and a consolidated response from the wider community, and no reason whatsoever why you can't also pick up maybe specific issue in your disease areas and include that in your own response as well. So that's the approach that will be taken here. So for the last part of the meeting, we're now going to bring in Dr. Florence Bingana from WHO African region to give us this regional perspective. And Dr. Bingana, maybe before we dive into the questions, and if people have questions for you, perhaps they can also put them in the chat. I'd be interested maybe just to have your initial feedback to what you've heard so far, and maybe your response to what Alex has just presented there.
Thank you very much. It was a very interesting session. It was really good to be a part of this. I hope you can hear me.
We can hear you. Yeah.
Yes. Okay, great.
Good start.
Yes, it was really good to be here because I think we had a conversation with you, but then being here this afternoon, I got a better understanding of what OneNeurology is going to be about. I think it's really going to be very important going forward. One has to think about what is the role of civil society versus the role of member states governments, and versus the role then of the UN and such international agencies. I didn't hear anything at all about the funding agencies like the World Bank or the EU and agencies like that, or bilaterals who may be the ones who fund some of the work that we do, but I think we need to talk about them as well. But yeah, I think each group has their different role to play, and together the outcome would be achieved if each does their own piece. Yeah, and within the civil society organizations, we have those that represent the people with lived experience themselves, whereas they are mixed. There are some that actually include carers and include providers of care. So it tends to be a little different. The other thing that stands out for me from the presentations was how strong, the way it seems to me, how strong the individual disease-specific organizations are in Europe, for instance, or other parts of the world, whereas here in our region, the only one we have, I would say, the strongest we have is the epilepsy groupings. So I don't think we have had, I may be mistaken, but and your organizations may be able to tell us, but I don't think here in the Africa region, as an example, we have one for headache or one for stroke or one for migraine. So those are, I think that's where we are a little different. It could be that because the services, access to services is so low, I think we have an even bigger service gap within neurology, much bigger even than for mental health. And therefore, people even just accessing care and then also mobilizing themselves after that, then to form these organizations is a very rare event. The other one I would say, somebody mentioned what are the issues rather than the disorders. And it came through, I think, in the prioritization of the different issues. Yeah, it's, I think the power of OneNeurology is the organizing around issues rather than organizing around disorders. If we have to raise awareness, that is, it's an issue about low awareness, but it doesn't say we'll raise awareness about one specific disorder. Each region and maybe even each country could decide where they are going to prioritize and then what awareness they would raise. But it would be a general kind of approach. I had a small concern in relation to the membership, because the way I had it, and maybe I'm mistaken, was it says it must be an international organization. or a regional umbrella. So now, if we have said that in the African region, what we have is, let's say, IBE or ILAE. Those are the international organizations who would be represented by the headquarters, maybe, in one of the outside countries, as we call them. It would not be Action AMAS, for instance. And yet Action AMAS cannot represent IBE Africa because it's a single disorder entity. And therefore, and I believe you're seeing it in the membership. The membership, therefore, is skewed to the higher income countries, to the northern countries. I'm not seeing any over, and I don't know how you're going to overcome that. I think you have to think about that if you want that representation there. Yeah, I think I'll stop there for now.
Yeah, no, that's actually a really good point. And this came up this morning, actually. I think the need to have, as well as this kind of global umbrella, to have a presence in the region. So kind of OneNeurology within the different regions of the world, in which perhaps those national groups could get involved and be active and really bring in their experience. Because I think we did realize that this morning as well, that by working through sort of the secretariats or the HQs at a global level, we're perhaps missing some of the real lived experience on the ground. And that was definitely a learning I think we took away, that we need to look at how we strengthen our regional presence and better involve some of those local and national groups that perhaps, don't always have the strongest voice within headquarters. And speaking of headquarters, one of the other questions that came up this morning, and I'd be interested to get your perspective on this, is that at WHO International, we now have a brain health unit as distinct from the mental health unit. But at a regional level, neurology and brain health often still comes under the umbrella of mental health, or it's integrated in something even bigger like non-communicable diseases. How do you think we can overcome that if the regional offices are to really play a role in implementing these actions in the area of neurology, if there's not a dedicated person or a team or a department who take responsibility for this?
I think it differs region to region. It will differ region to region. It may be even that the European region may have the resources to put a dedicated person there for neurological disorders, whereas the African region right now is one person doing everything that has to do with mental, neurological. Substance use disorders, we do divide the work with some others. But not only that, but there's also the division within, let's say, dementia being within life course. It's in a whole different other department. Child health would cover intellectual disabilities because they're mainly in children. And so we have all this breaking up. But I don't think it is about having the people in place. It's about us agreeing that this is the work that needs to be done and it will get done. If we agree that right now we are working very hard to see whether we can have a region, or we shall have a regional consultation next month as the Africa region, and it would be here, so it will happen. That does not mean that we need a person here who is a neurological staff to make sure it happens. If something has to be done, it will be done. And it's not just mental health. So even diabetes, we don't have a single person who's called a diabetes focal person. Neither do we have one who's called hypertension. So we have people who work generally on NCDs. We may have, if the funding allows, people who do, let's say, cancer. But it's unlikely that we shall have a designated person for neurological disorders, but the work will get done.
You say that the work will get done, but the plan is enormous and it covers, almost every angle that could be covered in the neurology field. Can you tell us how the regions approach something like that? How do you take a global action plan and prioritize aspects of it for your region, and then maybe say, this is what we're going to implement in the next kind of 10 years or whatever the time frame is? How does that work?
I think by the time the plan gets to be an action plan, that is a global action plan, the regions would have contributed. And as I said, we are having the consultation. So the member states will have contributed as well. So actually the demand to have this action plan starts with the member states when they have the World Health Assembly. So it is not something that is a result of HQ saying this is what we think we should do. And the development of the document has the participation of the member states as well. The role of the regional office, as I understand it at least, is more to facilitate the process for the member states then to do what they need to do. We would not prioritize and say, you have to do only this aspect or that aspect. For the African region, right now, we actually had a discussion this morning with IBE Africa, because we have already been having meetings with them regularly to see whether we can revise the regional epilepsy. It was a report that came out in around 2016, I believe, that we feel we need to maybe revise and maybe include other neurological disorders. So we may be having that conversation in the coming days to see whether we work with other disorders, revise that report. That report would then prioritize some of the areas, which that report would then be disseminated to the African countries. Because as was mentioned here today, the role of WHO is to make sure that the information is packaged in a way that the countries then have access to. Right now, most countries do prioritize epilepsy because it is a very common condition. It is preventable for the most part. A lot of the epilepsies in the Africa region are due to the weaknesses in the healthcare system that cause injuries during delivery. They are due to the high rates of injuries, road traffic accidents, meningitis, infections like that, fevers in early childhood, malaria, TB, you know, the common infectious disorders. And so if we were to get rid of these conditions, we would be able to get rid of a huge amount of the burden. And so a lot of it is going to be focusing on that. But at the same time, we also know that among the neurological disorders, stroke is actually #1, but it hasn't been up there. And so then the role of the regional office is to bring out this information, to prepare the documents and disseminate this information to the countries so they are made much more aware of what a big issue stroke is in our region as well, not just epilepsy, and then say, what then can we do about it? The things that prevent stroke are the same things, you know, that can prevent NCDs in general. And because we're already focusing on NCDs, if we do prevent the NCDs in a way, we are also preventing stroke. But I think it's something that we still need to be talking about. So that's one area. The other one would be the third for most sub-regions of our region would be headache or migraine. So it's prioritizing some of those issues, but also prioritizing some of the causative factors like NTDs, which haven't been mentioned, yeah?
Yeah, no, absolutely. And I think that was kind of the question I was going to ask you next, is how epilepsy can be used as an entry point for other neurological disorders. But I think that you've really explained that, you know, in some regions, there has been a lot of work done in that space already. And it's a way to maybe open that up and bring other neurological disorders into the mix. So I think that's clear. And I think what you've also made clear is the fact that actually it's going to be up to the member states to really take this, implement it, prioritize it, resource it, as opposed to the regional offices. And I wonder if you have any advice for the participants here today and OneNeurology more generally, in terms of, you know, when and how we should be targeting member states. You know, what should we be saying to them at this point? As you said, the political will is potentially already there because this came from the member states, not from WHO. but how do we really hold them to account and sort of push them to do something, not in 10 years, but maybe over the next 10 years, bit by bit?
And that's where the role of the civil society comes in. I think that's what I hinted at earlier. So when I started my work many years ago in the 90s in Uganda, it was very clear that mental health was not prioritized. And yet I could not be the same person advocating for mental health to be prioritized, because I, in essence, was the government. And so therefore we had three parallel NGOs set up, one for epilepsy, one for mental health, and one for children with learning disabilities as a beginning. This was in the 90s. And so they are the ones that were then provided skills in advocacy, so they could then advocate. They were trained in how to do advocacy for strengthening the need to have stronger mental health programs. And as a result of that, we were eventually able to get mental health prioritized, and mental health in Uganda included epilepsy. So I think the role of civil society is really important, because WHO being a member state organization, we can't be the ones telling the governments what to do at this point in time. But if there are civil society organizations in the countries, we can say we have the guidelines and we have the tools, and if you need the technical assistance, we can provide that. I think if countries want to do something, they need to be able to go and get the technical support they need, or the guidance to do what they need to do, and that's why we are there. But we cannot tell them, you should be doing this, you should prioritize this. Yeah. I think prioritization is also done at the global level, like through the SDGs. And that's, I think, one thing we also talked about, where the N has not come through as much. When we say 3.4, mental and neurological and substance use disorders, we have indicators for substance use disorders, and we have indicators or targets on severe mental health conditions and on suicide. But unfortunately, because we don't have an indicator for epilepsy or neurological disorders, therefore the prioritization of that area is a little weak.
And I think this is something that we've discussed already, is the need to develop, better indicators, better outcome measures, so that we can enforce some of these global initiatives where neurology is explicitly mentioned. But it is very hard, as you say, to enforce that and have it implemented on the ground. And I think what you've just said also underlines what we saw in the polling, that we need to do more advocacy and policy training and capacity building, and equip the civil society on the ground in all parts of the world to be able to reach out to their member states and to spread the word. So, there's so much we can do globally, but we need to make sure that that filters down. There's another question in the chat, and you alluded to this as well when you spoke earlier about private actors and groups like the World Bank, for example. Because one of the things Tadeusz brought up in his presentation was, how do we fund these actions, and how do we make sure we don't scare policymakers away by saying, brain disorders cost trillions of euros per year, and now we want you to implement these expensive solutions and make all of these new treatments accessible to all of those living with neurological disorders in your country. How do we get the funding in place to actually make this a reality? Is that possible?
That brings me to actually in relation to the Global Action Plan, one area where I have a bit of a challenge is that of having designated budget line for neurological disorders, because at country level, even here at the regional level, it's very difficult to say we shall have a budget line for neurological disorders. At country level, just to get many countries, at least in my region, in the African region, do not even have a mental health budget line. when they do have a mental health budget line, the allocation to that is very, very small. So they prioritize, often the resources go to institutions, up to 80, sometimes 90% of that very little budget goes to institutions. And these institutions, because the funding they are getting is not enough, end up being very poorly run institutions. So now, if we are going to advocate that this little bit of money be divided up and we have something called neurological disorders, I think it's going to be a big challenge. But it is possible to get funding as long as, I think as long as the plans are there, some work plan is there that identifies the different potential funding streams. The Global Fund is one as an example, because we know there's a link to neurological disorders with HIV and AIDS, or with TB, or even with malaria. So it is, how do we develop the guidelines or the tools that will ensure that when they are developing the Global Fund proposals, they do include something in there for those conditions. Right now, we know that COVID has had, during active COVID, but even those who have recovered long COVID, there are many neurological, sequelae. So we actually, I think there's mention of mental health as a big, the impact on mental health of COVID, but not so much, I think, neurology. They do talk about it a little bit, the loss of taste, the loss of smell, and other complications, but it doesn't seem to come out as much. And I don't think we're actually thinking of, let's allocate some resources to this. It's very difficult. I think it's very difficult to say that we would have a designated funding stream for neurological disorders, but that may be me. That may be me who is thinking that it's possible that the different agencies like the World Bank or the EU, if they say this is an area that has been prioritized, and sometimes there are some donors who come up and say, we want to prioritize this, and therefore we would get funds allocated to it.
Yeah, that's a conversation that we had earlier as well, around whether potentially we could push some member states that we know are very committed to brain health or to neurology to maybe put some funds on the table. And at EU level, the European Union and its member states were one of the co-sponsors of the resolution, which led to the 10-year intersectoral global action plan being developed. So potentially, there is some synergies that we could create there, but yeah, as you say, we probably need to think a little bit more creatively around how we could push for some more funding in this space. There's a couple of kind of side conversations going on in the chat, and one is quite interesting around identifying perhaps, key contacts and advocates in different parts of the world, and a number of people mentioning groups like the International Alliance for Patient Organizations or the Non-Communicable Disease Alliance, which are not disease specific per se, but would have people involved that maybe are familiar with the neurology space or who would work in similar areas. And I guess, that is a good suggestion as well, to try to follow up with some of those global groups in these parts of the world, and to see, if we have overlaps in terms of people and advocates and champions who we can work with to move things forward. Because as you say, in some parts, it's not as clear cut as it is that in other parts of the world. So definitely something we can take up. I wonder, does anybody else have any questions or comments that they would like to ask in terms of the role of the WHO regional offices, or specifically the situation in the African region that you would like to raise before we close this part of the discussion? Feel free to put a hand up, and I'm happy to hand over the floor if anyone would like to make a comment on anything they've heard. David, please.
Yes, Florence, thank you very much. That was extremely interesting to hear from you about the African situation. The European Academy of Neurology is somewhat aware of the situation about neurological disorders and neurologists in Africa, because we have been supporting, along with some other international organizations, courses that basically were organized by local neurologists, and supported by us. the question is this: I'm aware of the fact that since a couple of years there is the African Academy of Neurology, a very young organization that emerged out of the regional groups of neurologists that were active across Africa. Do you have any contacts to them, or have they sought any contacts to you? Because I guess that would be an important group to support you, or be a source, let's say, of consultations.
Yes, I would love to hear more about them, to get in touch with them. No, I have not been in touch with them. I am in touch with the Africa Academy of the Sciences. Are they linked to that academy at all?
Well, I wouldn't know. But let's try. Let's try a bit of networking, and perhaps bring you together, or with the other stakeholders, because Africa.
Yeah, that would be very, very useful.
From my perspective, you have challenges everywhere, and if you get together, then probably would be easier.
Yes. Definitely, I would like to get in touch with them. Yeah. If I may ask myself a question, for the organizations represented here at the HQ level, do they have branches or partners in the Africa region, just like IBE Africa chapter, for instance? So IBE does not have to respond, but do the others also have similar chapters in the Africa region?
Victoria, is that a question you might want to jump in on from the MS International Federation? I know in the chat you mentioned you work through IAPO, but is there an MS group, for example, or Sarah in the stroke space, or is there an African stroke organization?
Yeah, there is. Sorry to jump in. There is an African stroke organization that was established about a year ago, and it's both a health professional and a patient organization, and they are really, really keen to collaborate, very outward looking. So I would be very happy to facilitate links and also to share the OneNeurology initiative with them.
And just to jump in as well, so ShareCare Ghana might be one worth looking into. So they, although they're focused, although they are in Ghana, I think they do have links across the region. And then just thinking, with IAPO, actually, they've got if you go to their members page, they've got a whole list of all of their members in Africa, and particularly they've got, I think there are about 5 or 6 that are pan region, so it may just be worth having a look at that. Yeah, and I'm happy to put you in touch. Alexandra, I know you mentioned before that would be useful.
That would be great, Victoria. Yeah, thank you. And this morning, Florence, we had Alzheimer's Disease International and also the Confederation of Meningitis organizations, who of course have a lot of contacts in the African region. And we also have the World Federation of Neurology now under the umbrella. And I see in the chat, there's a few people mentioning groups in South Africa as well who are working in the neurology space. So maybe it's a little bit of a task for us, perhaps, to start mapping out amongst our partnership, because we do have the steering committee of the OneNeurology partnership meeting later this week. And one of the things maybe, Alex, we need to do there is to start to map out, where those global groups actually have a presence outside of maybe the usual parts of the world that we work very closely with, because I do think that will be an important next step for us. And it came out this morning and it's coming out again now that that's maybe one of the limitations we need to address. Great. So from my side then, Florence, I think you've even asked your own question and I've completely run out of questions that I was going to ask you. So at this point, maybe I'll hand it to you to make any final sort of suggestions, comments, thoughts that you have that you think are important to bring up. And then I'll bring Alex in to maybe outline some of the next steps that we have planned. And then Yoka will close the meeting. So over to you, Florence, if you have anything else you want to add into the discussion, and then Alex, the floor is yours.
No, I just want to say thank you so much for inviting me to be a part of this. It's been very, very educative for me. I think I have somewhere where we can start from. I'm glad that Action Amos was here. So hopefully we shall begin to see how to organize ourselves here in the African region, going beyond just epilepsy. And I think it's time that we did that as well. But as you heard, some of the organizations are still very young. That could be a good thing, because then maybe they'll go in the right direction, but it could also be that they are also trying to get their, feet on the ground, and so getting into this. Yeah, but I think it's a good time. It's a good time for us to have met. Yeah, hopefully we'll be working closely together going forward. I look forward to that.
And happy to help in any way we can. We'll absolutely stay in touch. Really appreciate your time this afternoon. And Alex, over to you.
Thank you, Donna. I think just before going ahead with the next step, it's very encouraging to see that this morning we had a representative of WHO Euro, and this afternoon we have Dr. Bengana with us from Afro. I think this is exactly what this initiative is about. It's being global, is also enabling the networking. This exchange in the chat is quite impressive when everyone really mentioned a contact they have in African. I mean, we are based here in Geneva, Brussels, etc. So for us, it's obviously difficult to reach out the civil society in the other region, but I would like to say that this is really an example that what we can achieve when we work all together. So I think one of the milestones of OneNeurology just being set up in March, as you all know, as Donna mentioned, it's in progress. So very encouraging. So thanks to all. In terms of next step, it's going to really echo what we said today and what we presented to you. So I'm not going to spend too much time on it, but just to give you a kind of overview and then to follow, obviously, with all of you after. So the first one, we have an important milestone to submit our comment to the GAP, which it's in the middle of the summer, the deadline, so 5th of August. So we will still manage to make sure that OneNeurology present his comments, and we encourage every other organization, part of neurology or not part of neurology, to really make some submission. I think we discussed about that, and it's very encouraging to address common issues, but at the same time still mention the disparities, etc. So the other next step important is to, and we saw it through the discussion today, it's to continue to raise awareness. We have an important momentum. I think here I may take an external hat. I work with other patient group community, and you have an amazing opportunity to have that policy framework front of you. And it's a 10 years plan. I don't want to duplicate what Tarun Dua said, but she's right. This is a unique opportunity you have. And if I can again stress on the fact that sometimes patients can feel left aside from those policy process, or can feel that their concerns are not really taken into account, we would really like to change that. If OneNeurology can really facilitate the fact that we end up with a plan of action that really address your concern, then we would have really make a difference. So we're going to continue to work. Obviously, as we mentioned also, our last opportunity now to provide comment on the draft is this one, August. After, it will go back to member states. So it will be really the member state that will take over, and we'll have the last, I would say, opportunity to comment on the second draft over the autumn for the adoption, not for the adoption, for the recommendation to the World Health Assembly in January during the executive board. So we will have to really work with the member states. And this to ensure that they will adopt, and it's not sure, they may not, but most importantly, that they adopt an ambitious, adequate draft. So we'll still have an opportunity to work with the member states in all different regions to make sure that they really push for certain priorities that you would like to see in your region. Then we will also have in parallel prepare for implementation. We mentioned several times budget allocation, prioritization. I think this has to be already worked out now. It's not when the plan will be adopted that suddenly we're going to have to advocate for that. It would be almost too late, even though we have 10 years, but still, we need to work with the member states. And I think I come back to the comment of Dr. Bengana that civil society is critical in this process at regional and national level. And then the last one about raising awareness and momentum is we need to make sure that we have a relevant monitoring and accountability process, because at the end we could have a plan that just is nice on the paper but doesn't make accountable any of the stakeholders, and this would be a shame. I don't think we will have that, but we need to make sure that this is really meaningful. The other kind of next step that is important, and again, we're starting to see it today with all the connections that have been made, is to continue to enhance the neurology community through this coordinated involvement through OneNeurology. I think OneNeurology has been set up for that purpose, so we hope that we will be able to continue to gather and most importantly to enhance the mobilization at regional and national level. And again, today really show the importance of work this out. And the other next step, and I will finish with that, is simply that get your community mobilized and involved. I cannot say even more again that you have a unique opportunity here. This is your plan. I come back to Dr. Chaudhary, what she mentioned when she presented through the video. Indeed, this is your plan. So if you want to influence, this is now. So we will have a next advocacy workshop that will be will really be about, again, updating about where we are with the process of the gap, but also looking at more at regional and national level how we progress. And there will be also a European summit in Brussels in December. So we will keep you all informed. If you want to also have more information, we have our website, oneneurology.net, and you can also reach us on info@oneneurology.net, and you have also EFNA contact details, Donna, Teidush, Yoke, and myself that help with this initiative. So thanks to you all on my side. I give the floor now to Yoke to hear her concluding words.
Good afternoon, everybody. How does one close a meeting like this, a day like this, I should say? I must say, when we embarked on this journey of starting the OneNeurology initiative and campaign, I was expecting this to have an impact, but after today's meetings, in the morning, the European or maybe Western affair, and now the Africa perspective, I am absolutely thrilled to have seen the engagement of the people that are partnering and working with us. So I am, as EFNA president, I'm really hopeful that within the coming months, the impact of the OneNeurology campaign is going to increase and to stay. So for the sake of time, I'm not going to dwell on this for very long, but let me say that we've heard the next steps just from Alexandra. We have seen the voting taking place by all of you on the actions on the global action plan. The very inspirational talks just now from Florence and this morning from the other speakers as well. We are going to send you slides, recordings, a report, most probably. I'm not sure about that, Donna, but yeah, I think
some
so.
kind of recap of
well, it's going to be really difficult, but anyway, you'll be fully informed of what's been happening here today. And let me just once again stress that we all have to realize that there is a momentum for all of us to make neurology a global public health priority. And for that reason, we have to come together, we have to work together, we have to speak with one voice. I really feel it's important to say that once again. It's been said many times, but and also EFNA, the OneNeurology group, will play a major part in this initiative in the years to come. I'm saying years, although I have no idea where that this is going at the moment. So let me then finish by thanking our speakers today, by thanking all of you for being with us, by thanking the EFNA team for the excellent organization. And also I want to say a special word of thanks to our sponsors. You've seen them mentioned in one of the slides by Dr. Dodik earlier today. And with that, I'm closing the meeting. Thank you very much.
Thank you, everybody. Bye-bye.
Thank you. Thank you. Bye-bye.
Good evening. Bye, everybody.